I'm Dr. Gerald Bach, and this is California Skin and Laser Center. I'm the sole physician here, and I own the entire facility and the practice. I've been in practice since 1974. Was trained as a dermatologist. I also have my board exams in pediatrics and in allergy and immunology, and I have a special certification in dermatopathology. But the main thing I do is dermatology and cosmetic dermatology. And the nature of dermatology has changed very much over the years. When I graduated, almost none of the stuff that we do now was taught during the residency, and I believe in keeping up, and one of my attitudes is that if you're not moving ahead, you're falling behind.
Dr. Bach is a person, a doctor, who knows what he's doing.
I've made it a practice of going around and visiting various physicians who are noted in their field. So I've worked, for example, with some of the very best injectors, fillers in the world, and I always try to keep up to date and find out what's new and different, and you always learn something every time you go to one of these courses. I think what is most satisfying is the response that people have to what we do. And what we do is we don't make people turn from ugly duckling into a swan. We change people in very subtle ways. We make them look better, but generally I tell my patients that when I do something for them, I don't want their friends to say, oh, who did your filler, or who did your lips? What I want their friends to say is, oh, I really like your new hairdo.
The procedures that I had were so natural, nobody knew.
The principles are that number one, we try to find out what the patient is interested in having done. Number two, I tell them, can we do this or can we not do it, and what would be involved if we can do it, and whether we can achieve it completely or whether we can achieve it just partially. And then frequently, in addition, I will see multiple things that are possible for us to do that they're not even aware exist. So we try to do things that are subtle, but it makes people feel better about themselves.
I enjoyed what I looked like, and so slight that people really didn't know that I had a procedure. They just said, gosh, you look really good. You're looking really good, you know? I said, yeah, that's true, I am. What I like especially about him is I said, I do not want to look like a 16-year-old, 84-year-old woman, you know? And so he said he never would do that. And I just never wanted to be like this, you know? I want to be just natural.
I've had fillers and Dysport. I use the Obagi line that he offers, and I've been so happy with that. I'm still using Obagi. Immediately after the treatment, I started noticing the difference, and I was very happy and satisfied. And I usually like to have him make the judge, or do the judgment call as to, okay, you go ahead, you make me beautiful, and of course he does.
Hi, Dr. Bach. How are you doing?
Good. So this is your second Dysport, is that right?
Yes, I had the first one done, and I am so happy with it.
So I love coming here. I feel prettier, I feel happier, I feel confident. When I leave, I'm just like a different person. Dr. Bach is always giving me so much information that I feel like I'm fully knowledgeable on what will happen, what the results will be, what I can expect.
We have a great staff. We have very low turnover in our staff. We have people who've been with us for over 35 years. They're an integral part of it. We couldn't function without the staff. They know the principles by which we operate, so that they're not going to mislead anybody on the phone any more than I'm going to mislead anybody in the exam room. When I talk to people about this, whether it makes a difference, they say, oh yeah, it makes a big difference. I feel better about myself, I interact better with other people, I perform better at my job, and all of these things are very rewarding to them, and it's rewarding to me to hear about it.